Welcome, I'm Eric Doan, Department Chair of Conservation Law Enforcement at Vincennes University. In this video, we'll look at the three most common causes of preventable death on the street and on the battlefield, as well as the measures we can take to save a life. Three common medical emergencies that often lead to death are hemorrhage from extremity wounds, tension pneumothorax, and airway obstructions. These are the injuries that we need to focus on for saving lives in combat. With very little medical training and equipment needed, a person can sustain life for an extended time by using these three techniques. Massive hemorrhage is an extreme loss of blood. Most bleeding can be stopped with direct pressure, but in some instances, such as a major arterial bleed, the only way to stop the bleeding is with a tourniquet. To apply a tourniquet, place it at least 2 to 3 inches from the wound. The tourniquet may be applied and secured over clothing. The tourniquet should be placed between the wound and the heart. Do not apply a tourniquet over a joint, such as an elbow, knee, wrist, or ankle. Now tighten the tourniquet to stop the bleeding. A second common injury in the field is a tension pneumothorax, commonly known as a sucking chest wound. This type of injury occurs when the chest cavity is punctured, possibly by a gunshot or a knife. The expansion and contraction of the lungs causes air to be pulled into the thoracic cavity, which causes the eventual collapse of the lung. To stop the bleeding and to keep the wound as clean as possible, we can apply an occlusive dressing. Occlusive dressings can be purchased at pharmacies or medical supply shops and kept as part of a first aid kit. But in an emergency, a bandage can be made with common items such as plastic bag and tape. An occlusive dressing is used to seal off wounds and surrounding tissue until a doctor can perform surgery. An airway obstruction is a common occurrence when a victim becomes unconscious and can quickly lead to suffocation. The position of the body can lead to the tongue falling into the back of the throat, blocking the airway. In some situations, bodily fluids like vomit and blood can also become an obstruction, causing the victim to drown in these fluids. A simple method to maintain an open airway is to place the victim into a recovery position. You've now seen first aid procedures that can be used to save lives in combat or in other emergencies. To learn more, look for our other videos on medical techniques and procedures.